This video presents one of the two Portuguese ESCMID collaborative centers, Hospital Beatriz, Ângelo. We're a collaborative center in infection prevention and control, and we're located in Lisbon, but our beautiful city is just the first reason why you should visit us. Our hospital is a Joint Commission International accredited paper-free general teaching public hospital with more than 400 beds and assisting a population of 278,000 inhabitants. Since we opened in 2012, we include a state-of-the-art facility with modern operating and procedure rooms, medical and surgical wards consisting only of individual and 2 bedrooms, pediatric and maternity wards, and a 22-bed ICU. Our team is multidisciplinary and it includes not only 2 infectious diseases specialists, but also a pharmacist and 3 infection prevention and control nurses. Our mission is, besides the risk assessment and implementation of every infection prevention and control measure, also epidemiological surveillance of bloodstream infections, other specific site infections, and infections due to epidemiologically significant organisms. We also have an antimicrobial stewardship program, and we review every antimicrobial from the watch and reserve groups of WHO, and we also provide support in dosage, duration, and route of administration assessment. Since we're a paper-free hospital, we developed a lot of e-health tools to help us provide the best care. Upon admission, every patient has an electronic admission epidemiological survey that is done upon admission to assess all the needs in terms of screening and isolation procedures. During inpatient stay, we have a lot of alerts set up for epidemiological surveillance, diagnostic workflows, all the updates in isolation procedures, and antimicrobial stewardship, conditioning, and stewardship through a lot of e-health solutions. Upon discharge, we have a specific site for IPC discharge notes, and we do follow-up, especially on surgical patients for surgical site. This is the view of our electronic admission epidemiological survey, and the responses that our colleagues provide will automatically generate biohazard alerts for us and an automatic prescription of colonization studies that are necessary considering the information. Here you have examples of our alerts for isolation procedures and review of these isolation procedures for epidemiological surveillance, especially for epidemiologically significant organisms, and an example of our discharge notes. Regarding antimicrobial stewardship, these tools allow us to assess the combination of the clinical syndrome with the antibiotic that is prescribed, and also assess compliance with our therapeutic protocols, and with this assess if the therapy is correct, and also assess dosage, duration, and route of administration. We also provide a lot of support for our colleagues in more complex infections, and we usually do a team approach with a team decision from our doctors and pharmacists in terms of these consults that we do for the different. We also do a lot of educational activities and training activities with the different departments, not only in hand hygiene, but also training in terms of other infection prevention and control strategies, and educational activities for antibiotic therapy and other stewardship interventions. We have collaborations with every local authority in terms of primary healthcare and public health institutions, along with our peers in other hospitals and our IPC and AMS national teams, and obviously this collaboration with ESCMID. We have many presentations and publications in national and international congresses, and we also try to give this educational approach to everyone that comes stay with us. We're responsible for every precaution needed for response to outbreaks, epidemics, and particularly pandemics like the current COVID-19. I'll leave you with data from all the admissions due to SARS-CoV-2 infection in our hospital, and the challenges we faced not only regarding COVID, but also in maintaining all of our other activities during this challenging period. And with this, I will thank you for your attention and hope you decide to come and get to know our center. Thank you.